Hi there. I just want to go around and show you my audience this evening. Javier, Elijah, Sarah, Ariana, Tara, Joe, Mike, Adriana, and Tanner. This will be my audience this evening on my persuasive speech. Have you seen the recent TV commercials about smokers and non-smokers wearing oxygen, suffering from COPD, cancer, stroke, and heart disease? Even worse, have lost a limb? These are true stories. Not only was my father a smoker and suffered from cancer, as a respiratory therapist, I see it every day. Did you know that smoking is the most preventable cause of heart disease and premature death in America? Each year, 430,000 Americans die from smoking-caused lung diseases. Those that smoke die 13 to 14 years sooner than those that are non-smokers. If you quit smoking, you will live a healthier life. I want to tell you how harmful tobacco is for you, others, and the benefits of quitting smoking. Did you know that tobacco contains many toxic chemical components? 7,000 chemicals, 250 known to be harmful, and at least 60 carcinogens, which are cancer-causing. And I'm going to show you a couple examples today. One would be arsenic that is in tobacco, as your mouse and rat poisoning. Ammonia, which you find in your household cleaner, such as Windex. Acetone, that you find in your nail polish. Cadmium, which is a battery component. And nicotine, which is also known as an alkaloid, are found in your insecticides. I don't know about you, but I'm not really sure I would want to have any of these chemicals in my body. If these chemicals aren't enough to make you quit, how about the problems smoking can cause to your body? Short-term problems. The addiction, need for supplies such as money, financial. Do you know how much a pack of cigarettes is today? How much a carton is? Increased work on the heart. Respiratory irritation such as hoarseness, coughing, shortness of breath, called the smoker's cough, smoker's voice, decrease in lung function, decrease in physical fitness, respiratory infections such as colds and pneumonia, tooth decay, gingivitis, fingertips are normally yellow to brown, not to mention the bad breath. And I just want to take a look and show you. Let's go to this one first. This is a picture of an airway model. This is what your airway should normally look like. And as you smoke, your airway starts to get narrow, mucus builds up to the point where over long-term of smoking, you can barely breathe. You're breathing through a little straw. So over time, it goes from a nice open airway to a very small, narrow airway. Long-term effects of smoking is cancer, heart disease, decrease in fertility, decrease in vision, such as cataracts, digestive issues, premature aging of the skin, wrinkles, or amputation of limbs. Now what I want you to do at this time is I want you to take your straws. If you just take, without putting your straws in your mouth, if you breathe in and breathe out, kind of demonstrates those lungs of a non-smoker. If you take your drinking straw and breathe in and breathe out through your straw, that's what it feels like breathing with very short-term effects of smoking. If you take your coffee straw, try to do the same thing, breathe in and breathe out, you'll notice it's much harder to do. This is an example of what it is with severe lung damage, usually in the very long-term smokers. If that's not enough to give you a demonstration, I'm also going to show you what a normal, healthy lung looks like. And over time, as you smoke, this is what it turns into. I don't know if anybody's seen any body exhibits, but they do show lungs of a healthy person versus a smoker. In our local doctor's office at work, we do have this little diagram that shows you the lungs, rib cage, and that is that of a normal, healthy lung. And again, as I just showed you, what a smoker's lung looks like. How's that look to everybody?
Not too good.
Smokers are not the only ones affected by smoking. What about the secondhand smokers? Each year, 38,000 people die from heart disease caused by other people's smoke. Living with a smoker increases a non-smoker's chance of developing lung cancer by 20 to 30%. Pregnant women are at a risk of having a baby with low birth weight. Children are exposed are at increased risk of SIDS, ear infections, and respiratory infections, and also slowing growth of their lungs. Just 30 minutes exposure is enough to decrease the blood flow, and can imagine being exposed your entire childhood to secondhand smoke as I was. If you quit today, there are many benefits. Immediate benefits such as your heart rate, respiratory rate decrease and return to normal. Within hours, you decrease of carbon dioxide, decrease of heart disease. Within weeks, increase circulation and decrease in respiratory issues. Within months, an increase in lung function, and you may even start to exercise. Some long-term benefits of smoking. After a year, you decrease your risk of heart disease by 50%. After 5 years, your risk of a stroke has decreased to 50% of that of smokers. You also decrease your lung cancer about 50% as opposed to smokers. 15 years after you quit smoking, your risk of heart disease is now comparable to those that never smoked. That's pretty impressive. If you quit before at the age of 30, you've decreased your chances of death by smoking by 90%. If you quit close to the age of 50, you decrease your risk by 50%. To conclude, this is why you must quit smoking for good. Truth of the matter is, there are so many negative physical effects to smoking. Yourself and others can benefit from you quitting. Think about your family and your future. There's no excuse to why you can't kick the habit. There are many programs to help at your local hospital, health department, and even internet. Or simply call 1-800-QUIT-NOW. So put the cigarette out and quit today. And here are some local brochures that the health department and hospitals offer to you: Quitting Fresh Air Lifestyles and 1-800-QUIT-NOW. Thank you.